Generalized Anxiety Disorder, GAD. Generalized anxiety disorder is a chronic condition characterized by persistent and excessive worry about everyday life. Unlike normal stress, which rises and falls depending on circumstances, GAD involves ongoing anxiety that feels difficult to control. The worry is often broad and unfocused, covering topics such as health, finances, relationships, work performance, or even minor daily responsibilities. The effects of GAD extend beyond mental distress. Physically, individuals may experience muscle tension, headaches, fatigue, restlessness, and difficulty sleeping. Many describe feeling on edge most of the time. Because the body remains in a prolonged state of alertness, concentration and decision-making can suffer. Over time, this constant strain can impact relationships and job performance. People with GAD are usually aware that their level of worry is excessive, yet they struggle to stop it. The condition can interfere significantly with quality of life, especially if left untreated.
Major Depressive Disorder, MDD. Major Depressive Disorder is a serious mood disorder marked by persistent sadness or a loss of interest in activities that were once enjoyable. Unlike temporary sadness caused by life events, MDD lasts at least 2 weeks and often much longer. It affects how a person feels, thinks, and functions in daily life. The effects of depression go beyond low mood. Individuals may experience changes in sleep, appetite, and energy levels. Some struggle with slowed thinking, difficulty concentrating, or feelings of hopelessness and worthlessness. Others may feel intense guilt or lose motivation to complete even simple tasks. In severe cases, thoughts of death or self-harm may occur. Depression can affect work performance, academic success, and personal relationships. It often creates a cycle in which low energy and withdrawal lead to further isolation. Although depression is common, it is not simply a matter of willpower. It is a medical condition that can significantly disrupt emotional, physical, and social functioning.
Social Anxiety Disorder. Social anxiety disorder is characterized by an intense and persistent fear of being judged, embarrassed, or negatively evaluated in social situations. While many people feel nervous before public speaking or meeting new people, this condition involves fear that is extreme, long-lasting, and disruptive. The anxiety often centers on worries about saying something wrong, appearing awkward, or being rejected. The effects of social anxiety disorder can significantly limit daily life. Individuals may avoid social gatherings, classroom participation, work presentations, or even casual conversations. Physical symptoms such as sweating, trembling, rapid heartbeat, and nausea are common during feared situations. Anticipatory anxiety, worrying for days or weeks before an event, can also occur. Over time, avoidance behaviors can lead to isolation, reduced career opportunities, and difficulty forming relationships. Many people recognize that their fear is excessive, yet the emotional and physical response feels overwhelming. If untreated, the disorder can restrict personal growth and reinforce patterns of withdrawal.
Post-traumatic stress disorder develops after exposure to a traumatic event, such as violence, serious accidents, natural disasters, or combat. While many people experience short-term distress after trauma, PTSD involves symptoms that persist for more than a month and significantly interfere with daily functioning. One of the primary effects of PTSD is re-experiencing the trauma through flashbacks, nightmares, or intrusive memories. These episodes can feel vivid and emotionally intense, as if the event is happening again. Individuals may also avoid reminders of the trauma, including specific places, conversations, or activities. This avoidance can disrupt relationships and limit daily life. PTSD often includes heightened arousal, such as being easily startled, constantly on guard, or struggling with sleep. Irritability and difficulty concentrating are also common. Over time, the condition can affect work, education, and personal relationships. PTSD is not a sign of weakness, but a response to overwhelming stress that can deeply impact emotional stability and sense of safety.
Attention Deficit Hyperactivity Disorder. Attention Deficit Hyperactivity Disorder is a neurodevelopmental condition that affects attention, impulse control, and activity levels. Although it is often diagnosed in childhood, many individuals continue to experience symptoms into adulthood. ADHD is not simply a matter of being distracted. It involves consistent patterns of difficulty that interfere with functioning across multiple settings. The effects of ADHD vary depending on whether inattention, hyperactivity, or impulsivity is most prominent. Inattentive symptoms may include difficulty focusing, forgetfulness, disorganization, and trouble completing tasks. Hyperactive and impulsive symptoms can involve restlessness, excessive talking, interrupting others, or acting without thinking through consequences. These challenges can affect academic performance, workplace productivity, and relationships. Adults with ADHD may struggle with time management and long-term planning. Children may face behavioral issues in structured environments. Over time, repeated difficulties can lead to frustration or low self-esteem. ADHD impacts executive functioning, meaning the brain systems responsible for planning, regulation, and sustained effort are affected.
Obsessive-compulsive disorder. Obsessive-compulsive disorder is characterized by recurring intrusive thoughts called obsessions and repetitive behaviors or mental acts known as compulsions. Obsessions often involve fears of contamination, harm, symmetry, or making mistakes. These thoughts are unwanted and cause significant anxiety or distress. Individuals with OCD typically recognize that the thoughts are irrational, but they feel unable to dismiss them. Compulsions are behaviors performed to reduce anxiety caused by obsessions. Common examples include excessive hand-washing, repeated checking, counting, arranging objects, or silently repeating phrases. While these actions may provide temporary relief, the anxiety usually returns, reinforcing the cycle. The effects of OCD can be time-consuming and disruptive. Some individuals spend hours each day performing rituals, which interferes with work, school, and relationships. Avoidance behaviors may also develop, limiting daily activities. OCD is not simply about being neat or organized. It involves distressing thought patterns and compulsive behaviors that significantly impair functioning and quality of life.
Bipolar disorder. Bipolar disorder is a mood disorder characterized by extreme shifts in mood, energy, and activity levels. Unlike typical mood changes, these shifts are intense and can last for days, weeks, or longer. The condition includes episodes of depression as well as episodes of mania or hypomania, depending on the type. During depressive episodes, individuals may experience persistent sadness, low energy, difficulty concentrating, and loss of interest in activities. In contrast, manic episodes involve unusually elevated or irritable mood, increased energy, reduced need for sleep, rapid speech, racing thoughts, and impulsive behavior. These periods can lead to risky decisions, financial problems, or strained relationships. The effects of bipolar disorder can be disruptive because mood states may change unpredictably. Work performance, academic progress, and personal relationships often suffer during severe episodes. Without treatment, the cycle between highs and lows can become more frequent or intense. Bipolar disorder affects emotional regulation and requires long-term management to stabilize mood patterns and daily functioning. Panic disorder. Panic disorder is characterized by recurrent and unexpected panic attacks, sudden episodes of intense fear that peak within minutes. These attacks often occur without clear warning and may not be tied to a specific situation. While panic attacks can happen in other anxiety conditions, panic disorder involves persistent concern about having additional attacks and behavioral changes related to that fear. The effects of a panic attack are both psychological and physical. Individuals may experience a racing heart, chest pain, dizziness, shortness of breath, sweating, trembling, or a sense of losing control. Some people fear they are having a heart attack or dying during an episode. After repeated attacks, individuals may begin avoiding places where previous episodes occurred. Over time, this avoidance can restrict daily life, leading to missed work, limited travel, or difficulty leaving home. The constant fear of another attack can create ongoing anxiety between episodes. Panic disorder significantly impacts quality of life by creating cycles of fear, anticipation, and avoidance. Eating disorders. Eating disorders are serious mental health conditions involving persistent disturbances in eating behaviors and body image. Although they differ in presentation, they share a strong connection to distorted perceptions of weight, shape, and self-worth. These disorders are not simply about food. They reflect complex psychological and emotional struggles. Anorexia nervosa involves severe restriction of food intake, intense fear of gaining weight, and a distorted body image. Bulimia nervosa includes cycles of binge eating followed by compensatory behaviors such as vomiting, excessive exercise, or fasting. Binge eating disorder involves recurrent episodes of consuming large amounts of food accompanied by feelings of loss of control, but without regular compensatory behaviors. The effects of eating disorders can be both psychological and physical. Individuals may experience depression, anxiety, social withdrawal, and medical complications affecting the heart, digestive system, and metabolism. These conditions can disrupt daily functioning and carry serious health risks if left untreated.
Narcissistic Personality Disorder is a long-term pattern of grandiosity, need for admiration, and limited empathy for others. While many people display confidence or self-focus at times, NPD involves persistent traits that significantly impair relationships and functioning. Individuals with this disorder often have an inflated sense of importance and may exaggerate achievements or talents. The effects of NPD are most visible in interpersonal relationships. People with this condition may seek constant validation, react strongly to criticism, and struggle to recognize or respond to the emotions of others. Despite appearing confident, their self-esteem is often fragile and dependent on external praise. When admiration is not received, feelings of anger, shame, or resentment may surface. Over time, patterns of entitlement, manipulation, or lack of accountability can strain friendships, family connections, and professional environments. Narcissistic personality disorder affects emotional regulation and relationship stability, often creating repeated cycles of conflict and dissatisfaction.
Schizophrenia. Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and perceives reality. It is classified as a psychotic disorder because it can involve a break from reality. Symptoms typically emerge in late adolescence or early adulthood and often require long-term treatment and management. The effects of schizophrenia are commonly divided into positive, negative, and cognitive symptoms. Positive symptoms include hallucinations, such as hearing voices, and delusions, which are fixed, false beliefs. Disorganized speech and behavior may also occur. Negative symptoms involve reduced emotional expression, lack of motivation, and social withdrawal. Cognitive symptoms can include difficulty concentrating, processing information, or making decisions. These symptoms can significantly impair work performance, academic progress, and personal relationships. Individuals may struggle with independent living without support. Schizophrenia is often misunderstood and stigmatized, but it is a medical condition involving complex changes in brain functioning that deeply affect perception, behavior, and daily life.
If you enjoyed this video, be sure to check this one out next.